All point of views expressed on Shop Talk 360 are solely the point of views of the individuals and do not represent any company, organization, or group. Shop Talk 360, the industry's dedicated platform for commercial design, construction, and facilities. With more than 25 years building for national retail brands, an award-winning and best-selling author, keynote speaker, industry coach, and event producer, here's our host of Shop Talk 360, Grace Daly.
Hey, Shop Talkers, welcome to our podcast. I have here with us our guest and my friend, Dennis with Galaxy Group. Dennis is a certified damage restoration contractor as well as a general contractor, and he's with a facility maintenance company that handles all services, including repairs, maintenance, sanitizing nationwide chains, at commercial properties as well as residential properties. Hey, Dennis, thank you so much for joining us.
Hey, Grace, thanks for having me.
So now, of course, we're in the midst of just a lot of chaos, a lot of sorrow, a lot of sadness. You know, there's a lot of misinformation out there, and it's so timely that we've connected because I wanted to definitely speak to our audience about sanitizing, and that's what you do. So why don't you share with us a little bit about what you do and some of the work you do for some of your chain commercial clients?
Right. So obviously, there's a lot of chaos right now. There is a lot of misinformation. And here at Galaxy Group, half of my time is being spent educating my clients, and the other half is actually servicing my clients. So right now, I would say the most familiar terms that everyone is hearing all the time is the deep cleaning, the sanitizing, and the disinfecting. Mostly, we are handling, commercial facilities, which includes restaurant chains, hotels, some schools, any kind of, retail stores, any kind of space that has human traffic in it.
Sure.
We're handling.
Sure. Now, are you?
Yeah.
I'm sorry. So, are you handling it as and I'm sure we won't mention any brand names, but are you handling it as a preventive maintenance for some of these chains, or is it like, oh gosh, oh no, they found out an employee or someone is an affected case of this virus, and then they're calling you in, or has it been both?
It actually has been both. Unfortunately, there have been some spaces that had, I would call it a mini outbreak, where more than, one person has been affected, and there have been deaths in a facility, or they didn't die in the facility, obviously, but they were people that either worked at a facility or was a customer or an occupant of a residential building. So we are handling both the immediate emergency disinfecting and also performing preventative maintenance and preventative disinfecting for other clients.
Okay. Now, it's really interesting because this whole world is so new to all of us. And I've been reading a lot more, and if I can ask you to share with our listeners what the difference is between antibacterial and antimicrobial, because I know many folks use them interchangeably, and quite honestly, I did too until recently. So maybe you can help kind of clarify that for our listeners.
Yes, no problem. So, I mean, antibacterial is exactly what it says. It's using, soap / detergent to remove bacteria. And an antibacterial will, in most cases, not kill any kind of virus, such as the COVID-19. whereas the antimicrobials are made to not only kill bacteria, but also kill fungus and some viruses. And typically, an antimicrobial will have a minimum of 70% alcohol, which is the only way you have a chance at killing more than just bacteria. You'd kill most viruses with the 70% alcohol.
Okay.
That's
so
the antimicrobial.
So the antimicrobial 70% alcohol, that's more like the hand sanitizers and such, is the way I equate it to. And then the antibacterial would be more the wipes to wipe down counters and such that we would get from like a typical store or for our home use, or even
generally
commercial.
speaking. Well, they'll, like the Clorox wipes typically are an antimicrobial, so they would kill, like they do say, the 99% of bacteria, germs, which do include viruses. And antibacterials are pretty specific. They're less intense. They're less harsh, obviously, on the skin, and that's why most people were using antibacterials before this pandemic. The antimicrobials are way more harsh on the skin and are really made for surfaces, not really for your skin, even though we're all using it constantly right now because we're less worried about drying up our skin and getting rashes than we are about the COVID-19.
Sure, absolutely. Okay, now my next question to you is, as a professional in your specialized industry of disaster recovery, restoration, and sanitizing, what is your top pieces of advice you can give to our listeners as we fare through these very challenging and daunting times? There's, with the continued number of infected cases that will continue to rise, unfortunately, and the continued loss of American lives that we're going to see rise.
Right. Well, we all have a personal responsibility to protect ourselves and our family first. So that would really include educating ourselves on how to best protect ourselves, which obviously, everyone's talking about, wearing a mask, wearing gloves, just taking the extra step in disinfecting the items that we touch, on a regular basis, the hottest touch points, they call them. So that's the first step, is really safeguarding ourselves and safeguarding our immediate family and friends and, staff, customers. But as a business and having a space where you do have staff and you do have customers, we have a responsibility to protect them because they're entering into a space where they don't know if it has been, disinfected properly. So we all have a responsibility, and we all have to kind of pitch in to really keep ourselves and, our colleagues safe, and also keep our spaces safe. And and like you said earlier, there is a lot of misinformation, and I'm hoping that we can clear it up right here on your podcast, because we can, go into a little bit of the different services that I find are being, claimed, that companies are claiming to do. And just as you're concerned about what's the difference between antimicrobial and antibacterial, we need to know what the cleaning services are performing and what they're saying they're doing. So we're totally educated, and businesses are educated, so they can keep everyone safe in their space. So I would say my biggest issue, or the biggest piece of misinformation, is regarding deep cleaning and disinfecting. So deep cleaning is really essentially cleaning. And what cleaning, by definition, it's using soap and detergent and typically manually cleaning, by hand. And quite frankly, cleaning is really removing dirt and soil and grime. It really is not eradicating virus.
Mm-hmm.
So, unfortunately, a lot of businesses and facilities are, receiving deep cleaning services that really are not eradicating that viruses that may be in their space.
Mm.
So that is, I would say, the most sensitive topic that we can talk about, but it's the truth.
Mm-hmm.
We need not only cleaning in our spaces, in our facilities, but we need a real disinfectant solution. And it goes beyond cleaning.
Mm-hmm.
And that's what I wanted to talk about, especially because a lot of people are not educated on the newest technologies of disinfecting that are very efficient and are very effective, way more effective than the traditional practices of janitorial services and traditional cleaning.
Okay. Share with us how that looks like with this new kind of equipment and approaches.
Okay, so what am I about to tell you is really going to disrupt a lot of the services that are going on right now. So there's been a technology built around electrostatic technology, where they've invented electrostatic sprayers that not only disinfect on contact, but also provide a charge to the disinfectant. So it literally wraps around and blasts every square inch, within range of the spraying. And how
Mm-hmm.
that differentiates from standard, pump sprayers and the traditional bottles of spray is that, traditional bottles of, sprayers that we, the Windex and pump sprayers, they blast out very large droplets of the disinfectant. And traditionally you have to wipe to evenly distribute it. And the problem with that is you're not getting every square inch. There's
Mm-hmm.
no way you can go into a space and wipe down every, square inch of a table. That means the top of the table, underneath the table, in the little
edges
crevices,
everywhere. Yep.
edges everywhere, the legs.
Sure.
And what this technology does, the electrostatic charge blasts out the disinfectant, and it wraps around with the same principle as electrostatic painting. You have spray painting that has been used in electrostatic to efficiently cover every square inch with paint. So the same thing applies with this the newer technology for disinfecting.
And then do you have to wipe it down? I'm sorry, do you have to wipe it down afterwards?
Wipe it. No,
Okay.
you don't have to wipe it. Technically, if it's a space that has, children and pets, you would want to wipe it.
Mm-hmm.
But here's the key component for disinfectants that a lot of people don't know either, is that you cannot wipe most disinfectants right after you spray it, or it will lose its value. So everyone must read the directions on their disinfectants, even if it's a Lysol or a commercial disinfectant like we're using in facilities. A lot of these disinfectants must be left wet for at least 10 minutes, sometimes 15 minutes for it to be effective.
Okay.
So this is a tidbit of information that you're not going to hear from the president, and sometimes you won't even hear it from the CDC or any kind of government body. These are things we have to educate ourselves on, and that's why this is a great conversation to tell your listeners, to expose them to this information.
Yeah, because honestly, I wouldn't have known. I would have sprayed some Lysol disinfectant, and I would have followed up with a paper towel, thinking I'm doing the right thing, thinking I'm wiping it down.
Yes. So you're actually spraying something on it's not doing anything because you're removing it before it really has its killing properties.
Okay. So help me understand this electrostatic sprayers. So it
Right.
sounds like I like the fact that it sounds like it's hitting every crevice, every edge, every corner. Because there's always human error when we're cleaning, right? We'll miss a spot and so on and so forth. So is it like a mist? Is it like a fog? How is it? I'm trying to understand how it's coming out.
Yes. So it's indeed it is like a mist, but it's a blast of a mist, and it's very small microns of mist, and the beauty and the genius of the electrostatic is that it's charging the liquid before it's blasted in these very small microns. I believe it's around, don't quote me on this, but I think it's a half micron to 2 microns, which is very small. I mean, most sprayers and pump sprayers, I believe, are in the 50 micron to 100 micron size. And fogging is what a lot of the so-called professionals are using right now, because you get better coverage with fogging, obviously, than a pump spray or a typical spray bottle. But electrostatic spraying is a whole nother level, and it really, like you said, it's getting every square inch. It has a charge to it, so it's attaching. It wants to attach to every, positive charge, which is on every surface. And the principle behind it is that every little micron of liquid is actually fighting and repelling each other. So, and it's looking for an opposite charge surface to attach itself to. So it's scientifically, its job is to really just kind of explode and attach itself to everything.
Okay, that's really interesting. So when you're explaining this to me, Dennis, I'm seeing this visual, and again, I'm a novice at this, so just be news all the time, but I do need to stay informed. But I see in other parts of the world where they're sanitizing, these people are in these hazmat suits, and it's in the street. It's everywhere. It's buildings. It's in the street, and it looks like they're spraying something that looks like a fog. I mean, would that be that type of electrostatic technology you're talking about, or is that different? And that brings up another question too, and maybe that's another discussion. I haven't seen that go on anywhere here in our country. I mean, and it's really point. It really scares me because you're in New York, I'm a native New Yorker. We all have our friends, family, clients, all in New York. And with what New York is going through, I don't know why that's not happening. And it kind of, I don't know, maybe there's something I don't understand with what other countries are doing. But have you seen those, like in the news or photographs of these guys with hazmat? Okay, so what do you think they're doing? You can only speculate, I guess, unless you know.
So yeah, I can't speculate, but if you look close enough, I know how to identify the electrostatic sprayers because there's really only a few on the market. So I can identify it, but sometimes they can be confused. Foggers can be confused as electrostatic sprayers, and a lot of cleaning companies are using pump sprayers, which even resemble electrostatic sprayers, but are far from an electrostatic sprayer. So that's why it's important that facility owners really get educated on this, because a lot of them are getting fooled into just doing a pretty standard cleaning job when we need to battle this new virus.
We do.
It's very effective at getting to us and spreading, and don't forget it remains on the surface after somebody touch. If you have coronavirus and you touch a surface, it's staying there sometimes for days.
Yeah, that's what I've read.
That's the serious part of this, and that's why we have to be educated on how we're going about disinfecting our facilities and our spaces. And quite frankly, at Galaxy, we have implemented a new program that is essentially an ongoing disinfectant treatment. So not only is it keeping the space safe upon the treatment, but it keeps protecting after we leave, which is a crucial factor to this, because you don't want to just go in and eradicate any potential virus, but you want it to keep protecting. And we're currently enrolling major chains, stores, retail chains, on a weekly and on a monthly program after the initial disinfectant treatment. And that's going to be the most important part, because this isn't a quick, pandemic that's just going to go away. It's actually going to come back. And
that's what there was discussion
definitively, they're saying it's definitively coming back, and that's based on science. So we have to continuously disinfect and protect, and that's why it's important that facilities sign into something that's on a regular basis, because this is not janitorial service that they're accustomed to getting. Most facilities already have that already, and hence we have this pandemic, because obviously that method did not protect us. So this is going to be the new normal service that's in addition to your standard janitorial service. And that's what facility owners and managers have to understand. This has to be implemented, or you're not protecting your staff and your customers.
Absolutely. You bring up a very good point. And you can probably relate to this. You're from New York. But I kind of feel the last couple of days, the last few weeks, especially more so the last couple of days, I kind of feel it's this whole energy is very much similar to 9/11, right? All this loss, all this sorrow, all this grief, but it's actually scarier because it will go on longer, and it most likely will come back, in the winter season, which was a huge concern. So it's definitely going to change the way we do business, the way retail, restaurant, hospitality, the way the whole world just is operating. It's definitely going to change that for a while now. So the good thing is I do see a lot of the essential businesses that are open, like the supermarkets, whether it's Publix, was one of the big ones. There's a lot of supermarkets now. They're going and they're actually installing, plexiglass to help with that social distancing, to protect their employee and also to protect the customer. So as an industry, what else do you think we can do better to protect each other?
Well, as you just mentioned, and we can relate to that. At Galaxy, we're getting hired from major food chains and retail stores to install the sneeze guard. And that is actually, it's a great resource of protection, because typically a customer and a cashier is in very close proximity, obviously closer than 6 feet, the recommended distance. So the sneeze guard is definitely going to drastically, prevent any kind of spread if a customer has, an infection, or if the cashier has the infection. Now that's going to help for the point of sale location, but what about the rest of the store? You can't have sneeze guards over everything, right?
Yes. Yep. The stock people. Yep. The merchandise.
And that's why we have implemented a disinfectant treatment program that does keep on protecting on a daily basis, on a weekly basis, on a monthly basis. And, not all of the chains and the big nationwide chains, they're still not fully educated on this yet. I mean, we're on the phone pretty much all day long, really having this conversation, the same exact conversation I'm having with you. I'm having with really the leaders and the top people and executives of major retail and food chains. And it's not their fault, because this is a new enemy. This is a new hazard. This came out of, pretty much almost out of nowhere, even though Corona has been around, but not this kind of, not the COVID-19. So the biggest way to protect is to prevent the ongoing spread, because it's going to continuously, the coronavirus isn't going anywhere, right? It's going to be a new enemy in our wheelhouse of viruses and disease. So in order for us to continue as a social society, with stores and interacting and restaurants, we need to protect ourselves and protect the spaces. And the only way to do it is to continuously protect it and take preventative measures. And that's why I'm saying it's essential to have an ongoing maintenance program of disinfectant treatments. It's essential. If they're not doing it when everybody opens up, then we're going to be right back in this situation in a few months from now.
Oh no! Yeah.
Yeah.
It's a very grave concern we're in, and I mean, we're recording this now on April 2nd, and I feel like we're waiting for the other shoe to drop, because we know in the weeks ahead it's only going to get worse by the numbers. So,
And the only reason why the numbers are going to go down is because generally everyone's inside. What happens when they open the floodgates and they say, all right, everyone back to work, everyone back to school? We're going to have more cases, because there's carriers of this disease that aren't even showing symptoms. They did a study out in, I believe, one of the cruise ships, and out of everyone that tested positive, they say they indicated, I believe it was somewhere between 15 and 20% of the people that were positive for the coronavirus had no symptoms.
Oh.
Which is pretty scary.
It is very scary. Yep.
Yes.
And also, too, to add to that, Dennis, it's scary because, so we're kind of like towards the end of flu season, I believe. So there was a lot of crossover, like, sometimes and then there's allergy season, and I have allergies, you know what I mean? And so what happens is that there's so many crossovers of symptoms sometimes that you're not even really sure, so it's definitely very scary. I did read, and I've seen several reports that I guess with coronavirus, aside from, the fever and some of the other symptoms that can be mistaken for flu, with coronavirus, though, there's been cases noted where you temporarily lose your sense of smell and taste. And what happens with the survivors of coronavirus, they some of them actually haven't gotten their sense of smell or taste back yet. So
Right.
there's just so many unknowns with this. So I just pray that the medical and science fields will continue to work very hard, and hopefully soon we will get a vaccination or have more understanding of this as this continues to unfold.
Yes, and unfortunately, we do. We are speaking to retailers that are not getting on board with an ongoing treatment, and quite frankly, I'm not going to name any names, but their excuse is that the government isn't mandating this service or this treatment, and that I mean, the government doesn't mandate a lot of things that affect us in a very negative way. We can't rely on the government, to tell us how to stay safe and how to be sanitary. I mean, they give us some, they give us some kind of instruction, but we can't rely on them. We have a lot to lose as businesses, and we don't want someone getting sick in our space.
Mm-hmm.
And not to mention the litigious, exposure. What if you did not keep your space clean and sanitized, and someone does get sick, or one of your staff gets one of your customers sick? The government isn't going to help you, and you might get sued if someone somehow contracts the virus through your space. And we've seen this happen before, where companies were at fault for not keeping their customers safe. I mean, it all started back, if you remember, the Tylenol scare.
Oh, yeah. Sure. That was, 20 years ago, maybe?
Yeah, that was a while ago.
It was a while ago.
Well, this is the same thing in a sense, except, we don't have a malicious person behind it. We have this, this virus that's way more scarier because, it's hard. You can't see it. You can't, it's hard to control. But you can control it with prevention and with protective measures. And that's why I keep stressing to the facility managers and operators and owners that you need an ongoing disinfectant treatment. And we have come up with that. And not a lot of companies are offering it because they're in it for, the quick initial, deep cleanings, because to be honest, a lot of companies are making money just traditionally cleaning. And that's not an effective way to eradicate this virus. It's not enough.
Well, I certainly appreciate all the information you shared with us. I'm hoping that all the industry leaders out there will do the right thing. Basically, do the right thing and take care of your employees and take care of your customers if you are still open, if you're an essential business. And just do the right thing. Be morally correct and do the right thing and take care of your employees. Because we still hear some, for the most part, a lot of folks have been stepping up. But we do hear, there's one chain where people were looking to walk away because they felt that they weren't being taken care of and there was no protection for them. And, and there's so much unknowns. And I think the fact that so many people are working on the front lines, right? So we have our police officers, we have our healthcare providers, the nurses and the doctors, those are our heroes. And then, what? In the same breath, the heroes also include, the cashiers, the grocers, the people who are there for the essential businesses, So we got to do the right thing by them. So I hope that they definitely, formulate a correct process to address this and truly ensure that the spaces are safe. So to wrap up very quickly, Dennis, I always try to wrap it up on an upbeat. So with that being said, we spoke mostly about your professional background. So now speaking more so as a leader of your family, what positive advice can you give, life advice can you give to us for the next few months ahead?
Well, I mean, as the head of the household, and just for anyone out there, obviously our families come first. And quite honestly, if we all educate and we all protect our own families, then we're actually helping in this fight against the COVID-19, because if we stay healthy, now our family can't hurt another family and spread the disease and spread the sickness and spread the virus. So we all have a responsibility to practice these new sanitary measures to help curtail this infection. And if we all do that, if we all pitch in, then we'll win the battle. And then again, it's also the responsibility of people that are, responsible for facilities where the public is entering into. So, they have a responsibility too, and we have to be able to trust them. And, we've come up with that solution. So you just have to look at the TV, do some research. It's all out there. We can't just look for cheap and quick solutions. We have to look for effective and efficient solutions. But the silver lining to this, because you did say, we should leave on an upbeat, but there is a silver lining to all this.
Yes, Dennis.
This was bound to happen. Okay, this there's always bacteria, fungus, viruses. I think the number is, I think nearly 70,000 people die a year from the flu, and we never really cared. We never, it never got this much hype and publicity in the news.
Focus, sure.
And focus, right. And there's tons of other disease and virus and funguses and, infection. There's MRSA, there's SARS. I mean, there's all forms of this. So by us stepping up our sanitary protocol, we're actually going to get less deaths from the flu and from the SARS and other infections. So that's the silver lining. I think this woke us up.
That's a very good point. Yeah, because we will be living, hopefully, in a safer environment. A safer being disinfected. And yes, okay. Yeah, that is. Yeah.
So
all right.
Everyone
I never thought of it that way.
Well, we have to, because everyone that's died from this, don't let them die in vain. Let them die by educating us that there's something serious out there that can kill us, that's invisible essentially, and it's not just COVID-19. So yeah, this is going to change the way we do business, the way we socially interact, the way we set our standards for sanitary practices as a human being. So like I said, the silver lining is there will be less deaths of all kinds of infections because of the way we change, when the way we adapt to this. Yeah.
All right. Well, Dennis from Galaxy Group, thank you so much for being a guest on Shop Talk 360. Really appreciate you sharing all your knowledge and your point of view. And I look forward to possibly a follow-up podcast. And maybe once we're, over the hump on this, and hopefully soon on the decline with the number of cases and the number of losses.
Yeah, we can only hope. And I appreciate you for having me, and everyone that's listening should appreciate you having this forum, because this literally can save lives. If we just get a few people that can appreciate this conversation and do the research, it will save lives. And I offer my email to anyone that has any questions, concerns.
Please.
And that's not only to potential clients that operate big facilities and chains, but it's also to other companies that are cleaning, because we're always looking for affiliates that can, that can also assimilate to our disinfectant protocol and do the right job. So I offer my email to anyone, and I answer everybody. It might not be immediate because of this pandemic, but anyone can reach out to me at Dennis, that's DENNIS, at GalaxyFMS.com. That's GalaxyFacilityManagementSolutions.com. So just use the initials, Dennis at GalaxyFMS.com.
Dennis, thank you so much for sharing with us. Please be safe, especially you're on our front line. Your team members are on our front line. So thank you for everything you do to keep everyone safe. And please be safe as well.
Thank you. And be healthy as well.
Thanks for joining Shop Talk 360. Real conversations in the commercial design, construction, and facilities industry. You can reach out to us at grace@gracedaily.com.